2 o'clock you went.
Yeah.
6:30 you waited 3.5 hours.
Yeah. Otherwise I'll be late.
How long will she stay in this clinic? She's now the first patient, so it will be the quickest.
Oh, you see, this one will give us we won't get a full reflection of how long they came, because you see, if you are 60 years old,
Yes.
60 or more, they put a stick of veteran.
Yes.
So you have an advantage of
She gets the privilege of
fast tracking.
stepping the queues.
Yes, fast tracking and the
Okay.
queue. They come in front, you see them even in the
They pass the
pharmacy,
queues there.
Exactly. So if you was below 60,
Yes.
you get a sense. But usually in Canada they leave at around about, can leave maybe at around about maybe 11, 12, depending on the blast again.
Thank you for talking to me, ma'am.
Words of comfort, words that never
So, in the Themba Lethu Clinic downstairs, we have about 17,000 patients. So that's grown into one of the largest clinics in South Africa for HIV patients. What we've realized now is that there's about 3 or 4 times as many patients that need to go on to treatment in South Africa. There's no more human resources to actually do that. We don't have any clinical staff, doctors, nurses, pharmacists who aren't already working in the private or public sector. So there's not an increase of capacity, so we actually need to find ways to treat 3 or 4 times as many patients with the same number of staff. So this integration project with our Therapy Edge clinical management system with Tri4 and ROA is intended on creating a way of more effectively getting patients their drugs. What we found is that patients come to clinics and they wait for 3 or 4 or 6 or 8 hours for their drugs, and it's impacting on their compliance in taking their drugs because they don't want to miss a day of work. And the goal of this project is for patients to be able to get their drugs within 15 minutes. The next stage of this project is to move the automation even further, where you can get your drugs with a smart card or a barcoded ID book, connected to a 24-hour call center for pharmacy support, and the patients can actually come after hours when the clinics are actually closed to get their drugs. And Right to Care, through the support of USAID and PEPFAR, has been able to fund this pilot project that we believe can be a concept that can be used throughout the public sector. With this concept, we believe that it can be an approach to national health insurance, but it's also an approach that will save the Department of Health money in the long run, because they'll more efficiently get service delivery of health services for a much lower cost. And this can only really happen through integrated systems, and an approach that Right to Care has always taken is that you must use the latest technology to solve problems in the public health sector.
Clearly, from the standpoint of HIV, the question is how do we begin to demonstrate sustainable interventions that can allow us to get a better handle on this epidemic. And clearly, until now, South Africa sees the private sector as that benchmark. So the challenge for us is to be able to demonstrate that we can indeed bring our services up to the level of what is currently available in the private sector. The 1.2 million South Africans that are currently in treatment have sort of overburdened facilities in the country. The ability to scale up treatment now to the 6 million South Africans that need it is clearly a serious sort of challenge for us. Certainly within the public sector, pharmacists don't have the opportunities and the time to do that. And I think the human resource constraints contribute to that. And in fact exacerbate that, so that you have pharmacists spending all of their time doing supply chain management functions rather than focusing on patient care. And I think automation provides that opportunity, because automation would relieve pharmacists from these sort of iterative, manual, routine tasks. I think it's a critical component. Clearly, automation has other benefits. It has benefits from the point of view of ensuring that your supply chain management activities and how pharmaceutical information is being managed is also optimized. It will also allow pharmaceutical services to be compliant with what statutory requirements and obligations are in terms of how state-procured commodities need to be managed. To be able to ensure that not just patients with HIV, but patients with other chronic illnesses have equal opportunities to be able to access their medicines in a manner that's convenient and accessible for them. Automation at the point of care clearly allows for that additional step.
Click on the first line. My mom is for prophylaxis, it's 2 days and so getting on the website.
IT scanning for your mouse.